All right. Thank you very much for joining Dr. Fossum's Pet Care Canine Cognitive Dysfunction webinar. I'd like to introduce Dr. Terry Fossum. Just a brief background on Dr. Fossum. She wrote the book Small Animal Surgery. And by the way, I have to brag about Dr. Fossum because she won't brag about herself. But Dr. Fossum is very, very well known and respected in the veterinary community. She wrote a book. She's a board certified surgeon, but she also wrote a book called Small Animal Surgery that's in its 5th edition, has sold over 50,000 textbooks globally, and it's been translated in over 11 languages. And so basically every veterinarian around the world knows exactly who Dr. Terry Fossum is. And so we're very fortunate that she's taking the time to speak to the pet owners to answer any questions you have. So the format we have, Dr. Fossum has some prepared remarks for everyone, and then at the end we'd like to open it up to a question and answer session. Please feel free to ask your question in real time. So in the Q&A portion, and so we will answer them at the end. But if you have questions, please feel free to ask them as the webinar goes on. So with that said, I'll turn it over to Dr. Fossum.
Great, thank you. So good morning, afternoon, or evening, depending on where you're located. It's my pleasure to be able to give this webinar. I do want to make a disclosure in that I am the CEO and co-founder of Dr. Fossum's Pet Care. And this is a very special topic for me, as it is for everybody on this call. And the reason being is that the picture that you're looking at is of my 2 dogs, 2 Labradors. One of them is 2 years old. He's Steely. He's a baby. But the other one is Dan. And Dan is 12 and a half years old. And I formed this company actually because of Dan. Initially because he had mobility issues and I wasn't happy with the CBD products that were on the market. So we developed those. But then the next thing...
I'm so sorry to cut you off. I just wanted to mention to everyone that this webinar is being recorded. So if you do not want to be a part of the recording, please drop off at this time. But for legal purposes, I just wanted to make everybody aware. So thank you very much. And sorry to interrupt, Dr. Fossum.
No problem. So Dan, my 12-and-a-half-year-old lab, started showing signs of cognitive dysfunction about a year ago. And so at that point, we decided that we needed a product. And so, again, that's why we've developed most of the products that we're developing, is that I see an unmet need in the market, and oftentimes it affects my own pets. So with that, let's get into cognitive dysfunction. And many of you may know that canine cognitive dysfunction, or CCD, is really the equivalent of Alzheimer's disease in people. The similarities are that, both affect elderly or at least older patients. There's usually a fairly gradual onset of dementia. The structural brain changes that occur with CCD and with Alzheimer's are pretty similar, which makes CCD in dogs a great model for testing new drugs and other therapies for Alzheimer's disease. We do see deposition of beta amyloid and tau protein in dogs, just like we see in people. And there are microvascular changes in the brain parenchyma. So pretty similar diseases. Well, how common is it? And the truth of the matter is, I'm going to give you some numbers that I don't believe. And the reason I don't believe them is that the majority of people believe that when their dogs become demented, that's just normal aging. They don't really recognize that this is a potentially treatable condition. So the literature will tell you between 14 and 35% of the pet dog population is affected. Again, I think it's much higher than that. And then it changes with age. Now, those are difficult statements to make because, in fact, not only does it change with age, but it changes with breeds. So we all know the large and giant breed dogs don't live as long as the small breed dogs, and they get cognitive dysfunction at an earlier age. So a Great Dane or even a Labrador, any of the giant or large breed dogs, if you wanted to talk prevention of cognitive dysfunction, you should probably be thinking 4 to 6 years of age. Whereas if you have a Yorkie, it might be 8 to 10 years of age. So when you need to start worrying about it really does depend upon the breed. So numbers I have there, 11, 12, 28%, 15, 16, 68%, take that for what it's worth. I think they're higher. There was a study that was a 2-year prospective longitudinal study that said that during that time frame, 33% of the geriatric dogs that they followed progressed to mild cognitive impairment, and 22% of the ones that were mildly impaired progressed to having full-blown cognitive dysfunction. And so it's obviously a concern for all of us that have older dogs or cats. The clinical features that we see the most is that as these dogs become demented, they become confused, and that makes them anxious. So anxiety is a key feature of this disease. One of the conditions that we see people complaining about the most, because it really disrupts their life, and that is that these dogs will develop an abnormal sleep-wake cycle, and they'll sleep during the day and they'll be awake at night. So they'll pace, they're restless, they tend to wake their owners up. And so owners don't get a good night's sleep, which is, obviously something that is very concerning for anybody. These dogs also tend to become less interactive with their owners. They don't really care if they're petted anymore. They change behaviorally, and they act confused. They are confused. Like they'll walk up, they might know where the door is to go outside, but they don't know which side of the door opens anymore. So they'll stand at the hinges of the door, or they'll get stuck in a corner and they don't know how to get out. So it's a devastating disease for these animals. So what are our treatment options? Well, there are a number. There are some drugs that we're going to talk about. Dietary modifications may help. There's some nutraceuticals, environmental enrichment. We'll talk a bit about that can help. Herbal therapy, and then there are a few other things we'll mention as we go through this presentation. So environmental enrichment can be really helpful to these dogs, just like it can be to people. Really think about people that develop dementia, early Alzheimer's. Enriching their environment can ward some of those signs off. And it's the same thing in dogs. So giving them a toy, especially a toy that requires them to complete a task, may be a benefit. Exercising these dogs definitely helps. And we understand that they're older dogs, they may have mobility issues. So you may find that you have to put them on something for mobility, and then you also have to put them on something for dementia. Interacting with them socially, taking them out to dog parks, letting them see your dogs will help. Experimentally and clinically, people have studied the effects of exercise on this disease and have definitely determined that there is a benefit. And there's this term that we use called cognitive reserve, which means that if we can build certain parts of our brain, if other parts of our brain maybe become less functional, we have enough reserve that you won't know, you won't see anything abnormal. So everything that we're trying to do with exercise and environmental enrichment is to build that cognitive reserve so that they're going to show signs later versus earlier in their lives. Well, what can you do from a diet perspective? Now, this is human, but we believe that it's similar in dogs, if not exactly the same in dogs. So foods that we believe will influence the development of Alzheimer's disease in people, the ones that may prevent or treat it, tend to be the plant-based foods. So you want to have a high intake of plant-based foods. You want to take antioxidants to protect your brain, probiotics, and we'll talk about why that may be important, but we are recognizing more and more a relationship with the gut microbiome in cognitive disease. Soybeans, omega-3 polyunsaturated fatty acids, whole grains, fruits, vegetables, nuts, medium chain triglyceride-rich foods, and fish. Kind of sounds like a Mediterranean diet. Things that may increase the risk of Alzheimer's disease is eating red meat or poultry, eating excessive amounts of refined sugars or processed foods, and high-fat dairy products. So those are definitely things that we want to stay away from, and we want to have our dogs not eat if they have any predisposition to this disease. Now, there are some commercial diets. This doesn't mean that you have to start cooking your dog food. There are some commercial diets that have been recommended for CCD. And if you take a look at the ones that I have listed there, what you'll see is that the majority of them contain medium chain triglycerides and then antioxidants. So vitamin E, vitamin C, EPA, DHA, omega-3 fatty acids. All of those are things that are thought to benefit animals with CCD. So these diets are pretty similar, as you can see. Some require prescription, some don't. I'm not recommending any one of these in particular, but you should certainly talk to your veterinarian about what diet they would recommend, particularly if your dog has any comorbidities. These are older dogs. They oftentimes have kidney disease or liver disease or cardiac disease as well. And so we do want to be a little careful with what we feed them and what other supplements we give them. I mentioned that we're beginning to understand with many diseases, actually, not just with Alzheimer's disease or CCD, that there's a relationship with the gut microbiome. That I think everybody's probably heard that in the last few years. It's become a pretty big deal. But what we know is that we will see synaptic changes in the intestine and in the blood-brain barrier as we get older. And that's associated with changes in our gut microbiome. So what happens, we believe, very simply, is that these microbes, some of them produce toxic products. And when those reach the brain, they cross the blood-brain barrier, the reaction of the brain parenchyma to that is that they produce these beta amyloid plaques. So there's a lot of thought now that CCD and Alzheimer's disease probably have some underlying infectious components, a microbial component to it. Exactly what that is, we don't know. And anybody who's followed the literature for Alzheimer's disease will know that even though there was just recently an FDA approved drug, it's not particularly effective. So we really do not understand the cause, but I think most people will tell you it's probably microbial related. So dietary manipulation can certainly benefit animals. The other thing, and this is true, I think, in people, but it's more, I think, important in dogs, and that is that inflammation, any kind of inflammation can cause CCD to occur, especially chronically over time. So one of the studies that Dr. Curtis Dewey published in 2021 was the association between periodontal disease and the risk of developing CCD. And what they found is that the worse the periodontal disease, the more apt these dogs were to develop CCD, probably again related to inflammation, a lot of microbes in the oral cavity. So good dental health in these dogs may be a benefit. There have been a ton of nutraceuticals and drugs that have been recommended for the treatment of CCD. At top of that list has to be omega-3 fatty acids and medium chain triglycerides, which again, we notice in all these diets that are purported to be for CCD in dogs. Phytochemicals such as curcumin, resveratrol, green tea, catechins are all of some benefit. Let me just a word here. I was speaking with somebody who's at Stanford, who's very knowledgeable about anti-aging. And he mentioned to me the other day that resveratrol has really gone out of favor. They don't believe that there's any benefit for anti-aging or dementia. So keep that in mind. It's still being purported out there, but I think it's a questionable benefit. SAMe is used, phosphatidylserine, pentoxylin, L-diprenol, the oral drugs. We'll talk about those more specifically in a minute. Any anti-inflammatory drugs, so carprofen, whatever, if you have your dog on an anti-inflammatory, like a non-steroidal, that may be a benefit, but there are lots of issues with non-steroidals in dogs, as most of you probably know, so I would be careful with that as a therapy. And the other question would be, if these have all been found to be a benefit, how would you get that many different drugs into one dog? I mean, no owner, at least no owner in their right mind, is going to go out and buy all these different ingredients and mix their own product. But, if we could, we'd give them all these. So what are the ones that are now being touted for CCD? And probably top of the list has to be Anapril, which also has a number of other names I've listed there, but it is essentially siligylene hydrochloride, which is an irreversible and selective inhibitor of monoamine oxidase, B. There's A and B, not important, but it actually affects B. And so we believe that the therapeutic effects are because we enhance the catecholaminergic nerve function, and that increases dopamine levels. So you've probably read that, for Parkinson's disease, we increase dopamine levels. That's what this drug is also attempting to do. And it is FDA approved for CCD, but also for Cushing's disease in dogs. There have been a fair number of side effects noted for this drug. Most of them not too serious, but can be bothersome. So vomiting, diarrhea, hyperactivity, inappetence, lethargy, hearing loss, which is interesting, and then itching and shaking have all been associated with Anapril. Another drug that some of you may have your dogs on is Senilife. There is evidence that it's efficacious, but it takes usually at least a month to see any benefits. And it is contraindicated in dogs that are on anticoagulants, so do be aware of that. But it's generally well tolerated, and it contains some Western ingredients. Phosphatidylserine, which you're going to see in all of these, ginkgo, again, resveratrol, which I think is a little to no benefit, and then vitamin D, which is really put in as an antioxidant. So there are more side effects to this drug, and those are vomiting, diarrhea, restlessness, disorientation, or confusion, which is difficult because that's what we're trying to treat. Some dogs become more aggressive. They may have repetitive movements. They may be more lethargic or tired. They may drool, itch, lick a lot, tremble. Again, they may become inappetent. They may also develop deafness, and some of these dogs will pant continually while they're on it. So obviously some dogs have no side effects, and some dogs show many of those. So do be aware. Activate is another one that's out there. Again, the onset of action is usually 3 to 4 weeks or longer before you're going to see any benefit, but it is generally well tolerated. It is only Western ingredients really in it. Phosphatidylserine again, the omega-3 fatty acids, carnitine, which is generally a drug we actually give for cardiac disease in dogs, coenzyme Q10, selenium, vitamin E, vitamin C, and alpha lipoic acid are the ingredients. Just a word, this drug there's an activate for dogs and an activate for cats. And the cat product is essentially exactly the same as a dog, minus the alpha lipoic acid. Alpha lipoic acid can be toxic to cats, so don't give your dog activate to your cat. If you're going to give it, buy the cat one and get that, just to get rid of that alpha lipoic acid. So that's really kind of the Western ingredients that are out there that you're going to commonly see. If you do a search, you'll find all of those products. But there are also some herbal formulas that have been recommended, and these are Chinese herbal therapies. They don't have any Western nutraceuticals in them. They're just Chinese herbs. And so I have a number of them listed here, but you can buy these, again, through the internet. How beneficial they are, honestly, individually, I don't know. So what we decided to do, because I wasn't convinced that I wanted to put my own dog on just any of the products that just had Western in, and I definitely didn't just want to use Chinese herbs, is we decided that we wanted to do an integrative supplement that combined Chinese herbal and conventional nutraceuticals in one capsule, so that owners didn't have to go out and buy multiple ingredients. Everything that we thought was safe and efficacious, we put into this one product. We spent a lot of time researching the individual ingredients, particularly the Chinese herbs, and I'll mention that more here in a minute. But Dr. Curtis Dewey is a veterinary neurologist, and he is certified in Chinese herbal therapy. And so we worked with him to develop this formula. The next challenge that we had, because we were dealing with a lot of Chinese herbs, is finding the best high quality ingredients that we could source, obviously from China. So we came out with a list like this. We found a lot of Chinese herbs that have been mentioned for cognitive dysfunction, either in dogs or in people, and the rationale for why they're being used. And we put that list together. You see that here. And then we picked out the ones that we thought would be most efficacious. And so the product that we developed is called CogniCaps. And it is a combination of Chinese herbs and Western, more conventional nutraceuticals. The ingredients have all been National Animal Supplement Council certified. And again, this was developed primarily with Dr. There are obviously products out there that can be of benefit. You may have to play around with them a bit and be careful, because again, most of them do have side effects. the products that we developed, the Cognicaps, I am not aware of any side effects from that in particular, but Sean takes a lot of the calls. We have somebody who can probably answer that maybe even better than I, but we don't hear much of anything really as far as adverse side effects. But we do hear of a lot of dogs that benefit from this. We have a lot of people. So with any of these products, what you'll hear, if they work, is that the people will tell you that they were about ready to euthanize their dog. They were giving up. They didn't know what else to do. And then they started on these products and their dogs got better. So we just did a small pilot study on our product, and we saw almost a 40% improvement in cognitive function within 30 days. So, and a lot of them show improvement in 2 weeks. So definitely something, if you have a dog that you believe has cognitive dysfunction, definitely worth putting him on one of these compounds, nutraceuticals, or the FDA approved product, whatever you want to try, and just see if it helps your dog, because the odds are that probably is going to help. One of these will help, but you may have to play around with them a bit. So I will end with that. Happy to answer questions. We plan on this being about 30 minutes of discussion and then the rest Q&A. So I am happy to answer questions. And Sean, I'll let you read the questions off to me, and I'll be happy to answer them.
Sure. So we did have a couple prepared questions, but I'm seeing some questions coming in. So the first question is, what is the max dose of Cognicaps that you can give?
That's a great question, and I don't know that there is a max dose. We have not heard of side effects. I honestly don't think you can overdose the product, but we dose it based on size. So we have a small and we have one for large. It's a single capsule for small dogs and double for the large dogs. But I wouldn't worry about overdosing them. I don't think you can actually do that.
Perfect. And then the next question is, can you combine Cognicaps with CBD?
Oh, good question. Yes. In fact, my own dog, Dan, is on both. So I give him the CBD for mobility. And actually interesting, we don't really know what happened with Dan, but about 6 months ago, he started seizuring. We worked him up. He did not. I was worried that he had a brain tumor. He did not. He had idiopathic epilepsy. And the CBG, and so we sell a product that has CBD, CBG, and CBN in it. CBG, just for everybody out there, if you have a dog with seizures, CBG is the cannabinoid for seizures. It's better than CBD. The combination of CBD and CBG is better for seizures than just CBD alone. But absolutely, you can combine them. Like I said, my own dog is on both.
Okay, great. The next question was, is there a way to get these products into Europe?
Oh, we're working on that. So Cognicaps, not a problem. It does not have cannabinoids in it. The issues that we have found is trying to export to other countries cannabinoid products, so CBD. That has been tougher. But Cognicaps, because it doesn't contain it, we can generally get it into other countries. Right now, we're selling that product in internationally in Taiwan, Singapore, Hong Kong, and Thailand. And we're talking with Japanese distributors, but we'd love to have more. So if any of you are from Europe and you have distributors, let us know. We'd love to talk with them and get our product out there, and because it's helping dogs.
Thank you. And so how does CCD progress over time, and what can pet owners expect in terms of a long-term prognosis?
Yeah, good question. So I think it progresses differently in every dog, just like all Alzheimer's progresses differently. Some you may start noticing things. Let's say you have a Labrador like I have. You may start noticing at 7 or 8 years of age that they don't seem. They occasionally have issues finding things or even getting outside, and they may urinate and defecate in the house, and it's not because they're out of control. It's because they don't, they just get confused. So you may start seeing mild signs, and then over time it will progress. Generally, it's going to progress within a year to a year and a half. But again, it varies depending on the breed and the dog and some of these other things. If you have a really active dog, you're really good about exercising him, you walk him every day, you're probably going to delay the severe, moderate to severe signs. We do have, if you question whether your dog has CCD or not, if you go on our website, drfossums.com, we do have a little survey that you can take, and you can assess whether your dog has CCD and how severe it is by answering those questions. So I would encourage you to do that.
And if I can just add something there, and I'll be sending the link out later. It's drfossums.com/surveys. And you just click on the cognitive function button at the top. And every time you take the survey, it'll show you your percentage change. So if you take it, and what I'm trying to say is it's a good way, if you take it every 30 days, you can kind of see how the progression of how your dog is doing over time. So I'll be sure to send that link out at the end of the presentation. The next question is, has Cognicabs proven beneficial in patients with late stage CCD?
So late stage or severe CCD, typically what we'll do with the dogs that are severe is, and I just want to be really upfront, it's not going to help every dog out there. But the dogs that it helps, which are a great many of them, it'll take them from severe maybe to moderate, or if they're moderate, it'll take them to mild. So you'll see an improvement, but they may not, become normal with it. But even severe, so I should have mentioned this. I've told you the similarities between Alzheimer's disease and CCD. There's also a big difference. And the difference is that for reasons we don't understand, CCD is more readily treatable than Alzheimer's disease is. So you can expect more improvement from your dog than you're going to see in people with this condition.
Okay, thank you. The next question, would you consider raw goat's milk and or cow's milk, kefir, to fatty acid with regards to food to stay away? I use both significantly for nutrition, or is dairy in general preferred to stay away from?
So high fat dairy products should be stayed away from. Quite honestly, in general, I would stay away from dairy products in dogs in general. A lot of dogs don't tolerate them. So if your dog does, that's great. But a lot of dogs don't tolerate dairy products. It will give them, pretty severe diarrhea. But if it works, I'm not sure that we know. I don't know that I can answer your question as to whether or not it's going to affect their CCD if it's not a high fat dairy product. But I would definitely keep them away from any of the high fat products.
Thank you. And then another question is, have you heard of selegiline affecting mobility / balance? Also, any thoughts on using, I apologize here, Leviter Keppra, and combining selegiline with Keppra? I'm totally desperate, have dog with severe CCD and massive mobility issues. I'm running out of options.
Yeah. So my own dog, when my dog developed the seizures, we started him on Keppra. It didn't get very long, quite honestly, because he didn't tolerate it well. So we just went with the CBD on him, with the CBG on him. I have not tried the leviathan, and I know I'm not saying that correctly. I have not tried that, but let me reach out, put that a note on that, Sean, and let's reach out to Dr. Dewey and see if he has any experience, since he's more apt as a neurologist to treat dogs with that drug.
No problem. And then the next question is, can you speak about brain stimulation activities or any way to engage and or slow the degeneration?
Yeah, there's actually there are some other therapies that have been tried for CCD, which does really are brain stimulation techniques. There's no good data on any of those techniques, unfortunately. So, it's definitely, there's no evidence to say that they will help. So I would say stimulation is important, but that's social interaction. That's, working with your dog, talking with your dog, playing with your dog. Those will definitely help delay the onset of symptoms in dogs that are affected. So, but as far as, like other types of brain stimulation, there's just no data out there.
Okay, great. That's all the questions we've had. So if you have any more questions, please put them in the chat. While we're waiting for more questions, if they come in, a couple things. So I mentioned that I'll be sending you an email with this recording as well as the survey that you can take for CCD. It's a really, really good way to kind of figure out where your dog is at on the spectrum, as well as track the progression over time. The next thing is I will also be sending out the CogniCaps study, which Dr. Fossum mentioned earlier in the call, which it shows a 38% improvement in cognitive scores in 30 days, and it ticks up to 41% over 60 days. So those are the two things. I'll also be sending a link to a CCD Facebook group. It's a great way to learn a little bit more. We would love it if you could join and contribute to the community. There's a lot of good information that can get passed around, and it's a good way to kind of show information. Lastly, we'll be creating a forum shortly as well. So if you have any questions, you can place it in the forum, and we'll keep that live as a repository for the rest of the community. So if there's a question that's being asked and Dr. Fossum's answers it, we can handle that. There's a reference guide basically out there, a reference point for other folks to look at over time, and so that way we can share success stories and also any sort of hardships that you're facing. We did have another question coming in the meantime, and it's, do you offer online consults?
I was just going to say that I answer questions on a routine basis for our clients, and I'm happy. I consider you guys, since you watched this webinar, you're now part of our family. So if you have questions, feel free to reach out to me, Terry at drfossums.com, and I will do everything that I can to help you. And it's not a consult per se. I'm not going to charge you. I'm just happy to help. So feel free to reach out.
Yeah, and just to add on to that, Dr. Fossum has dedicated her life to helping animals. So yes, this is a business for her, but this is really truly a passion. And you can tell that when she's answering questions, all day long. We will be hosting more webinars as over the next couple months so you can learn more. I'm very active on Facebook groups as well. And the one thing I did want to add as well is I see a lot of folks that are using CBD as a way to help their dogs sleep at night. And I just want you to be kind of cautious of the products that you're using for CBD to make sure that they're actually giving the best benefit. So I have a couple blog posts on that, but really pay attention to the concentration that you're giving of CBD. Our view is that you need to give 1 milligram or 2 milligrams of CBD per kilogram of dog weight. So that's one of the primary areas that we want to make sure that you're giving your dog enough to actually being able to see the difference. And as the person who takes a lot of the customer service calls, I have seen a lot of people use Cognicaps in conjunction with our Rejuvenator tincture, and that has been very successful as well. So in helping not with, across the board, helping a dog keep calm, it's certainly really good to help out with mobility. And your dog's not going to be a puppy again, but it's certainly been helping out. So
I do want to, Sean, let me just throw out that
Sure.
One of the things I'm really interested in is anti-aging, the senolytics. And so I am working with the co-founder of the Stanford Innovation Lab, which they're right at the cutting edge of all the new anti-aging drugs. And we are going to be coming out with a couple new products in the next 6 months or so that my dog will be on for sure, because I truly believe they have anti-aging benefits. So keep an eye out for those. We've got a cardiac support product coming out. We're going to be coming out with a new product for itching in dogs, and the product has a really unique mechanism of action. So keep an eye out for some great products.
Awesome. We do have a couple more questions that have come in. Can you tell us about common mistakes to avoid when dealing with CCD, please?
Honestly, I would say the biggest mistake that I see made by people that have dogs with CCD is that they don't recognize that it's CCD. They just think it's aging, and so they don't do anything. And their dogs just suffer. And we kind of say they suffer in silence because people just don't recognize. That is by far and away the biggest mistake that is made.
Thank you. And then the next one, can you comment on use of Xanax for night and suitability for selegiline? Is there a better sedative to give? Xanax doesn't seem to work for us. Thank you.
Ooh, a better sedative. Yeah, I don't use Xanax in dogs much. So, well, let's see. It really depends on why you're giving it. Is it because they're anxious? Is it because they're painful? There are a number, like gabapentin, for example, is out there, supposed to be for mobility, but quite honestly, is it will sedate dogs. My own dog I used to give it to him. I don't give it to him anymore because he became too sedated. So I mean, you might try gabapentin. Talk to your veterinarian, though. I'm a little hesitant to recommend anything because I don't know what other drugs your dog might be on or what other comorbidities they may have. So talk to your veterinarian, but just tell them that you want something that will remove the anxiety but not sedate your dog too much. Cannabinoids will do that. So, if you want to try something not from your veterinarian, try a CBD product, a good one. Sean started to say, be careful. A lot of the products that are out on the market, because it's not regulated. A lot of the products out there with CBD they may not have any CBD in them. So you really need to look at the certificate of analysis, or, talk to somebody and find a very trusted brand, because you'll find not only might there not be any CBD in it, but the cannabis plant is a soil remediator. It pulls everything out of the soil. So if that plant is planted where, say, maybe tobacco was grown and they use a lot of insecticides and herbicides, that's what you're going to be giving your dog, because it gets concentrated in the flower. So be very careful that you check out the products. There's just a lot of really bad products on the market. And that's why I decided to make my own. I just was not comfortable with what I was seeing out there.
100% agree. And, I can't tell you how many people I've talked to who have tried other CBD products on the market. They said CBD doesn't work for my dog. And then they in desperation, they try our product and they see their dog go back to kind of like the term that they use is your product has helped to wind back the hands of time. And I've heard that from countless customers that have come in. So again, natural products in general, and any product for that matter, doesn't work for, it's not suitable for every single dog. And it's certainly important to consult your veterinarian, but you know, I can wholeheartedly put my name behind the Dr. Fossum's Rejuvenator.
And let me say one other thing about, so irregardless of what product you're going to use, be careful about the dosing. We get so many clients in that will bring in, you know, a bottle of CBD and they'll go, well, this is, I'm giving my dog and it's not helping. And I can't even figure out how much they're actually giving because the bottle doesn't actually give us a concentration. But sometimes when we do figure it out, the dose that has been recommended is so low that I wouldn't expect it to have any benefit. So, you know, do be careful with the dosing as well. We usually recommend 2 mg per kg, 2 milligrams per kilogram twice a day as a loading dose. And then generally you can reduce that to 1 milligram per kilogram. My dog's been on 2 forever. The one thing I will tell you about with any of the cannabinoid products, CBD, CBG, CBN, you can't harm dogs with it. You cannot give enough to harm them.
I think we'll definitely be doing a CBD webinar specifically, so we can probably save some of the questions for that. William, I noticed that you had your hand raised, so I want to make sure I give you the floor. Can you put your question in the chat, please? And while William is doing that, I did want to mention that we have a very, very strong referral program. And what that means is if you believe in our products, which I know we have some customers on the call, as well as other folks, but if you refer your product, the person who, if that person spends $100, you get 25% of their order in store credit. So and that's forever. So if you recommend 4 people and they start to subscribe, you can effectively earn free products for the lifetime of your dog. So we really, really worked hard at making these products affordable. And if you don't have a referring party, we donate 25% of your order to a shelter in need. So we're not just out here. This is a business, but we are here to truly help other animals. And our take on that is we'd rather incentivize our users to help us grow through word of mouth than paying an agency, some Madison Avenue agency, a bunch of money to try and, you know, grow us that way. We'd rather grow organically through our community. And you are all now part of our community. So we're very appreciative of that. And
that's why you're free to ask me questions, email me. If you got a question, I'll do my best to answer.
Fantastic. So William, I didn't see your question come through, but if you have one, feel free to email me and we'll make sure that Dr. Fossum gets it answered. And that's the same thing. My email is Sean, that's SEAN @drfossums.com. Or you can email info@drfossums.com as well. And then we do have another question that just came in. Any CBD with CBG that is trusted and available in Europe? We tried several different brands with COAs that didn't see any result.
Boy, I don't. Unfortunately, I don't know what's allowed in Europe. We are trying to get into that market. But again, I will tell you the cannabinoids are really tough to export into almost any country. They want the cannabis grown generally in that country. That's why it's so difficult to, but we're working on trying to get it into Europe. So, but I don't know. I can ask. I have veterinary friends in Europe, and I can certainly ask if they have a product that they would recommend.
Yeah. So, just so we're on the same page, Katerina, make sure that the biggest thing is you want a product that with the strongest cannabinoid profile that you can find. So avoid products that are and for the most part, Europe, I believe it's 0.1% THC. So we don't actually have any THC in our products, but all the other cannabinoids, you want to see the highest concentrate possible. So everybody just focuses on CBD. And I know you mentioned about CBG, but you really have to just check the COA or reach out to the company and ask them. Yeah, so a 3,000 milligram bottle it's certainly that's a high concentration of CBD. I want to also make sure that you're using it at least twice a day, and making sure that it's not just 3,000 milligrams of CBD. Make sure that there's a broad spectrum, and what that means is, CBD, CBG, CBN. I mean, there's 140 cannabinoids, but also terpenes as well. So linalool, myrcene. Oh my goodness, I could go on forever, but they're all losing. I'm forgetting them. But you basically you want to get as close to the hemp plant as you possibly can. So that means that the oil might be a little bit darker, and that's going to help. That's going to help with the entourage effect. But we'll have a whole nother webinar on CBD. I know we kind of switched over to CBD chat for a second there, but
let me just say, Katerina, up the dose, try a higher dose. I don't know what dose you were taking, but if you were taking, say, 2 milligrams per kilogram, try 4. You're not going to hurt at 4. You're not going to hurt at 10, to be honest. So up the dose to 4 and see if that gives some help.
Okay, so I'm going to really quickly, so we might be able to get one more question in from William. I'm going to see if I can, William, yeah, so William, you should have the ability to unmute your microphone at this point. So if you have questions, now's your chance.
Thank you, and I'm sorry that I couldn't communicate by typing.
No problem.
Dr. Fossum, I'm a physician assistant by training, trained in public health 40 some odd years ago, and I can't tell you how much I appreciate your dedication, your commitment, and your keeping this webinar free of bias towards your product. I think you really tried to advocate for dogs, and in the human world, I know it's very difficult to accomplish, and I think you really did it here. So, bingo and a credit to you. I want to cut to the chase now with my thank you. I'm disappointed, by the way, that the participation was so limited, but hopefully people will see it after the fact. But kudos to you. I want to cut to the chase. I was late joining the webinar, and I want to ask you about preventative strategies. I picked up on the fact that you really focused on cognitive engagement of dogs to prevent CBD, but I'm curious if there are any other supplements from a preventative perspective. I heard some reference of omega-3s. I'm not sure if I heard any reference to some GI protectant, but I'm curious if there's anything that you might suggest in a 10-year-old dog. And I do have to tell you that one nutraceutical that is off the market now, so I feel comfortable mentioning it. We used it in a 12-year-old Old English sheepdog several years ago, Nutrix. I thought it was snake oil, and the dog did remarkably well. So I will tell you that your product will be our go-to product if we ever find the need to go there again. I think you provide compelling reason to do that. But I did want to mention that we did have this really positive experience with this product that's now off the market. But I do want to circle back to preventative steps other than cognitive engagement to see what your thoughts are, and I thank you for the floor.
Well, thank you, William. Really appreciate the comments. So we actually developed CogniCaps as a preventative. We thought if we could get people to start using it early, we could maybe prevent or at least delay the onset of CCD. We didn't honestly expect to actually reverse the clinical signs, which we did in the study. And granted, it was a small study. It was only 10 dogs, so we need to do a much larger study. But the 40% improvement that we saw is not what we expected, frankly. So, I mean, I have a 3-year-old, so we have Steely and Dan. Dan's the 12-and-a-half-year-old. Steely is my now 3-year-old lab. He will be started on CogniCaps when he is 6 years of age, and he will be on it for his entire life because I think it may actually help prevent. Other than that, diet, I mean, certainly, I think MCT oil is beneficial. So anything, give them one of those diets or make your own diet. That and exercise are the two best things I think you can do for prevention.
Dr. Fossum, what about and sorry, but just brushing the dog's teeth more often? Do you think that would be beneficial as well?
Yeah, I think dental hygiene is important, just like it is in people. We all know inflammation in our gums can lead to inflammation everywhere in our body. Same in dogs. So good dental hygiene is important. So brushing the dog's teeth. The other thing, William, for prevention is I truly believe probiotics may be a benefit. So a good probiotic would be something you put your dog on now that I think could help. So yeah, but dental hygiene, I think there's no doubt there is an association. So that's important. So thank you for mentioning that, Sean. I hadn't thought about that.
Thank you for providing me the floor and for your wonderful explanation. I'm in fact on the way to pick our dogs up today from their annual dental. So thank you for mentioning that.
Okay.
And thank you for the mention of probiotics. I think we're doing things right. So thank you for that.
Oh, good. Sounds like you're a great dog owner.
Yeah, the one thing I can say for sure is everybody on this call that's taking the time and sitting on a webinar to learn about these things is obviously trying to do the very best for their dog. And so we thank you for all that you're doing for your dogs. So this will be available as a YouTube link, but I'm going to tie it to the site. So basically everybody can go to the site to view this webinar. And we really appreciate your participation, and please share it with your friends and family. We would love to any feedback that you can give, we'd love to and referrals would be fantastic. So thank you again for your time and effort and for being amazing pet parents.
Thank you, guys. Take care.
Thank you.